Mild intellectual disabilities. In very young children with mild intellectual disabilities, there may be no obvious problems, but as they enter school, they often demonstrate difficulties in academic skills. As they become adults, abstract thinking and short-term memory are reduced, and communication is more immature than expected for their age. They may have difficulties regulating their emotions or have impaired social judgment, which puts them at risk of being manipulated by others. The individual may be independent with their activities of daily living, ADLs, and personal hygiene needs, but requires support with shopping, cooking, housekeeping, and managing money. They may require assistance in finding appropriate leisure activities, as well as making healthcare decisions and legal decisions. Individuals with mild disabilities may be employed in jobs that don't require much decision-making. Moderate intellectual disabilities. The conceptual skills of individuals with moderate intellectual disability can be observed because they are behind in development compared to their peers. For school-aged children, their academic achievement is limited, and their learning progress is slow in all areas compared to their peers. As they become adults, their academic skills typically remain at a primary school level. They rely on spoken words for communication and are often unable to understand written instructions. They develop personal relationships, although they may not perceive or interpret social cues accurately. Social judgment and decision-making abilities are limited, and appointed caregivers must assist them with important life decisions. An individual with moderate intellectual disabilities can achieve most of their ADLs if given appropriate time, verbal cues, and supervision to ensure they complete all personal hygiene needs. Similar guidance is needed for other household and life skills. Employment requires considerable support from coworkers and supervisors. Disruptive behaviors may be present that cause socialization problems.